Hello guys. Today KEA Tutorials presents to you a gastrointestinal disorder, gastritis. Definition. In order to define gastritis, dissecting the word is necessary. Gastra, which means stomach. Itis, which means inflammation. Fusing the two portion gives us the complete definition of gastritis, which is inflammation of the stomach. Under the types of gastritis, we have acute gastritis, when the onset of symptoms is sudden. Common subtypes under acute are acute H. pylori gastritis, when a sudden infection by H. pylori produces symptoms. Acute infective gastritis, when it's caused by other microorganisms like bacteria, viruses or fungi. Non-infective gastritis, when it's not an infection that causes it, like spicy foods and irritants. Then we have chronic gastritis, when the symptoms are recurrent and persistent for long periods of time. Subtypes are Type A, which is autoimmune. Type B, which is H. pylori related. Type AB, which is environmental. And chemical, which is as a result of acid reflux like in conditions like GERD. Risk factors. Factors that increase your risk of gastritis include bacterial infection. Although infection with Helicobacter pylori is among the most common worldwide human infections, only some people with the infection develop gastritis or other upper gastrointestinal disorders. Doctors believe vulnerability to the bacterium could be inherited or could be caused by lifestyle choices, such as smoking and diet. Regular use of pain relievers. Pain relievers, commonly referred to as nonsteroidal anti-inflammatory drugs, such as ibuprofen, can cause both acute gastritis and chronic gastritis. Using these pain relievers regularly or taking too much of these drugs may reduce a key substance that helps preserve the protective lining of your stomach. Older age. Older adults have an increased risk of gastritis because the stomach lining tends to thin with age, and because older adults are more likely to have H. pylori infection, or autoimmune disorders than younger people are. Excessive alcohol use. Alcohol can irritate and erode your stomach lining, which makes your stomach more vulnerable to digestive juices. Excessive alcohol use is more likely to cause acute gastritis. Stress. Severe stress due to major surgery, injury, burns or severe infections can cause acute gastritis. Your own body attacking cells in your stomach. Called autoimmune gastritis. This type of pathophysiology. In fact, there's a balance between the mucus layer of the stomach and that of the acid it contains. But due to some factors, weakness or injury to the mucus-lined barrier that protects the stomach wall allows digestive juices to damage and inflame the stomach lining, leading to this condition, gastritis. The signs and symptoms of gastritis are heartburn, nausea, vomiting, epigastric pain, mild fever, and indigestion. Diagnosing gastritis begin from physical examination. The doctor palpates the epigastric area and observes for signs of inflammation. History. Past medical history is necessary in diagnosing chronic gastritis. More specifically, the doctor will test H. pylori, because of its strong potential of leading to this condition. Imaging is also required. Tests like upper abdominal X-ray or upper abdominal endoscopy, to view the status of your stomach. In order to treat gastritis, two options can be viable. A. The medical option, with the use of medications to control the symptoms and clear off H. pylori if it's the cause. Classes of drugs that can be used are 1. Antacids, which neutralize the effect of gastric acids. 2. Proton pump inhibitors, which reduce the amount of acid produced by the stomach. 3. Histamine 2 blockers, which reduce the production of acid by the stomach. And 4. Antibiotics, which clear off bacterial infections. B. The surgical option, This option comes to play when we're at the stage of complications. When gastritis progresses to the stage of ulcer or stomach cancer, surgery might be a better option. Surgical procedures like 1. Gastrectomy, which is partial or complete removal of the stomach. 2. Vagotomy, which is vagus nerve resection to reduce the amount of acid produced. In prevention, the following measures can be adopted. 1. Avoid consuming over-seasoned meals or anything that could irritate the stomach. 2. Avoid excessive alcohol, because it can lead to gastritis. 3. Avoid consuming pain relievers over the counter. 4. Stay away from stress. And 5. Do routine medical checkups, to determine any underlying condition that can lead to gastritis. The complications of gastritis are peptic ulcer, gastric cancer, and bleeding. Thanks for watching. Don't forget to like, subscribe and smash the notification icon so that YouTube keeps you updated of our activities. See you in another video.